Good morning, I'm Mr. Piet and welcome to Relax, a show that explores respiratory care medications. Today we have with us Mr. Thatch.
Good morning.
Miss Adams.
Good morning.
And Mr. Brundage.
Hello.
Today's topic are sedatives and paralytics. The first set of sedatives that we have today are Propofol, Lorazepam, and Versed.
Well, Propofol is used for general anesthesia, sedation of mechanically ventilated patients, and ICU patients. And the dosage for Propofol is 40 milligrams every 10 seconds until induction onset.
Lorazepam, also known as Ativan. Some of the indications are anxiety, insomnia due to anxiety, and pre-medication anesthetic procedures. And some of the dosages are, for IM it's 0.05, and for IV it's 0.044 to 2 milligrams, whichever one is less, or for another IV it's 0.05 to 4 milligrams 15 to 20 minutes before the procedure.
Versed is used for induction of amnesia, preoperative and procedural sedation, and sedation for mechanically ventilated patients. The dosage of Versed is 1 to 2 milligrams IV over at least 2 minutes.
What is the mode of actions for sedatives, Mr. Brundage?
Sedatives increase the activity of gamma-aminobutyric acid, thereby producing a calming effect, relaxing skeletal muscles, and inducing sleep.
Any medications given to a patient can cause adverse reactions within the body. So I ask myself, what are the adverse side effects of sedatives? Some side effects that we have for sedatives are apnea, respiratory acidosis, respiratory depression, heart failure, seizure, and delirium. Calculations for these drugs are very important so you know exactly how many micrograms of the medication your patient is given. We have Mr. Thatch here to help explain more on these calculations.
So I brought a whiteboard to better explain the calculation of a sedative. 4 milligrams of lorazepam is ordered. You have a vial with 10 milligrams per milliliters. How much do you need? So we're just going to use this equation. The original dose over per ml equals the desired dose over per ml. So the original dose is 10 milligrams over milliliters, which is the per ml, equals 4 milligrams over x, because we're trying to find the per ml. So we're just going to cross multiply. 10x equals 4, and just work it out. Solve for x equals 0.4 milliliters. To monitor the effectiveness of a sedative, you want to listen to the patient because pain is subjective. To counteract this, you could also have the patient administer the sedative through PCA, which is pain-controlled anesthesia. In doing so would avoid the delay in the patient waiting for the dose from a nurse. And you also want to monitor it for respiratory depression because respiratory depression is a common side effect of sedatives.
Let's move on to our next segment, paralytics. The most commonly used paralytics are Pancuronium, Vecuronium, and Rocuronium.
So for Pancuronium, the indications are induction of neuromuscular blockage, percutaneous fetal procedure, and the dosages are 0.04 to 0.1 milligrams IV, and then for an increase in dose, start at increments of 0.01 milligrams per kilograms.
Vecuronium bromide is essentially a supporter to general anesthesia. This drug is classified as a non-depolarizing, neuromuscular blocking agent, which means our primary contact with this drug will be as a precursor in the facilitation of endotracheal intubation because it provides skeletal muscle relaxation during surgery or mechanical ventilation. Vecuronium is for intravenous injection only. Each vial contains 10 milligrams or 20 milligrams of Vecuronium bromide. However, it is most commonly available commercially as ampules containing 4 or 10 milligrams of the drug in powdered form. One last thing is to never use a paralytic without a sedative.
Rocuronium is indicated for general anesthesia during surgery or mechanical ventilation. Also indicated for rapid sequence intubation and neuromuscular blockade. The normal dosage for Rocuronium is 0.6 milligrams per kilogram, and a lower dosage may be used at 0.45 milligrams per kilogram.
So, Mr. Brundage, what is the mode of action for paralytics?
For paralytics, there are two different modes of actions. You have depolarizing and non-depolarizing. Depolarizing binds to the acetylcholine receptors and causes prolonged polarization. By preventing repolarization, the muscles remain flaccid. Succinylcholine is the only depolarizing paralytic. Non-depolarizing competes with acetylcholine for binding at the receptor sites. This in turn blocks the depolarizing effects of acetylcholine and prevents muscle contraction, which in turn causes paralysis.
And Miss Adam, what are some of the side effects we have for these paralytics?
That's a good question. Some of the side effects are apnea, respiratory depression, and bronchospasms.
Mr. Thatch, can we please have a calculation on a paralytic?
Here's an example for a paralytic. Alright. If a doctor asks for a dosage schedule requiring 0.20 milligrams per kilograms of body weight for Pancuronium, what dose is needed for a 90 kilogram person? So we're just going to take 0.20 milligrams over kilograms. We're just going to times it by the person's body weight, which is 90 kilograms. So the kilograms basically cancel out and you just multiply across, which equals 18 milligrams. To monitor the effectiveness of a paralytic, you should understand the drug because some drug metabolizes faster than others, and also cardiac and anxiety signs are lost since the patient is paralyzed. So you should monitor the cardiac and vital signs. Signs such as tachycardia, hypertension, diaphoresis are physiological responses if there is inadequate sedation or lack of pain control.
And that's all we have for today's show, and I hope you learned something.
Yeah.
Boom.
Where did I leave off?
Why would I say good morning, Mr. Brundage?
Perfect.
Oh, you shouldn't have looked off to my left.
Be given to a
For general anesthesia, sedation.
What the delirium?
Okay. Try to think of what I just said.
Yeah.
I didn't like that. All I heard was it.
Today we will be Jesus.
Rocuronium is generally.
You want to administer more paralytic.
No, like that whole, that sounded a lot better.
Okay, we'll start that over.